So you can treat pigmentation, uneven skin tone, and uneven texture, improve acne scarring, helps with fine lines and wrinkles to reduce that, helps to minimize the pore size, increase collagen and elastin production. So it's a very stimulating treatment. And then helping to reduction of sagging skin. So that elastin network is going to be strengthened. So you will have that tightening effect all over the skin. And then we can also treat stretch marks. So it can be in the neck area, or it can be on the body as well. So it's not for the face. So when you do it on the body, you can just use your 36 needle. So it's just a little bit more needles that you will then use. Okay, perfect. Okay, so the skin peel is an advanced medical grade automated fractional microneedling device. So it's with a very powerful German motor, and it also has your adjustable needle length. So with one pin, you can basically treat various types of concerns. So it is safe to use on most skin types. And it is used to treat and improve conditions like acne scarring, fine lines and wrinkles, sagging skin, uneven skin texture. So that whole is what we just went through. So with one needle, you can change the depth per treatment. So under the eye area, you can work on a 0.25. Then on the forehead, you can do a 0.5, and then a little bit deeper if your client should need it on the cheeks and on the décolleté and neck area. So in one treatment, you can, play around quite nicely. Okay. So treatments with a micro needle pen does not burn the skin like your normal laser would do.
Okay.
So it doesn't dissolve it like your chemical peels, or abrade or scrape it like your microdermabrasion. So microneedling with a skin pen gently stimulates the skin with very fine needles that encourages your natural collagen production. So you are basically creating a controlled injury to the skin. So with your needles puncturing the skin, and that will then stimulate your fibroblast cells, your immune response to basically heal the skin, and in turn you will get your visible results with that. So your microneedling treatment has been proven more effective than some surgical treatments, laser resurfacing, and chemical peels in stimulating the production of your collagen and elastin, which is going to reinforce the skin, remove wrinkles, and then also smooth scars. So microneedling is only sold to professional therapists and for professional treatments only. So your client isn't going to go home with the microneedling machine. So I know in the market there are other, brands that do offer those type of treatments for home use, but we want to use it only for professional treatments in salon.
Correct.
And then the skin salon of the skin pen is only available to Sknlogic stockers.
Yes.
Okay. And then your therapists that are doing the treatment, they should have a qualification in cosmetology, and then they should have a minimum of a 2-year salon experience. So we are very picky with who we allow to do this treatment.
Okay.
Okay, so what is microneedling? So collagen induction therapy, or CIT, or microneedling, is the procedure by which the body's natural response to healing is used to increase the amount of extracellular matrix, such as your collagen and your elastin in the skin, is stimulated. So the skin then rapidly creates a pattern of microchannels in the treatment area, or little micropunctures, and these microchannels significantly increases the production of collagen and elastin to leave the skin much more smoother, fresher, and more uniform. So in these micro channels also create micro injuries, like I've mentioned before, which causes the body to send blood and growth factors to the area, resulting in a glowing skin. And also, because you have created these micro channels, the products that you will be using during the treatment and afterwards will be absorbed so much deeper into the skin to be actually used where the new cells are produced. Okay.
Got it. Uh-huh.
Okay. So there are 3 phases to wound repair, to the wound repair process. So phase 1 is your inflammation. So when you pierce the skin, it basically triggers your immune response to disinfect the wound and to remove debris and increase blood flow, and it begins to create new tissue. So that is what your inflammation process is. So that is that little bit of redness on the skin, a little bit of swelling, a little bit of edema, those type of things. Then your second phase is going to be your proliferation. So this is when the wound is rebuilt with new granulation cells and new cells are produced, as well as temporary collagen and elastin, which are part of the extracellular matrix. And then also a new network of blood vessels are developed during this stage. Then during the third stage, your remodeling stage. So this is where the wound is replaced with new dermal tissue and with new blood vessels. And then the collagen that was created in your proliferation stage in the newly formed tissue is replaced by your stronger type 1 collagen. So your more permanent type collagen, which can contract and create a tightening or shrink wrap effect on the skin. So that is when you'll feel your skin is a lot tighter and your skin looks a lot smoother.
Okay.
So these micro skin channels carry up to 80% more of your topical nutrients, allowing penetration of the active ingredients much deeper into the dermis fibroblast. So this is where—
Sorry, Hannah, just a question. Sorry. When we talk about skin tightening, are we also referring, is it going to be the same outlook or result like your Botox?
Look, your Botox is basically going to numb your skin. So it basically interrupts the jump between the synapses and that causes your facial expression. So, but with your microneedling basically tightening, it's basically strengthening your network. So it's a more of a permanent result where your Botox is just cutting off the signals between your muscles. So muscles is not responding at all, whereas with your microneedling and the collagen being strengthened, the more permanent result on the skin.
Okay. And then earlier as well, you mentioned something, I think perhaps it's been with the first phase with inflammation. When you start piercing the skin, there is going to be the reddishness, but is it at the end of the session, does the skin get back to normal, or is it still going to be a bit swollen?
So it depends from person to person, but you are quite red after the treatment, and depending how deep you go into the skin as well. So that will also determine how long you are going to be red after the treatment. So your clients should know that they are going to be red, they are going to be warm. Sometimes there can be a little bit of bleeding, they can have some swelling. So if they've got a big function that they need to go to, so I would rather suggest that they do it over a weekend or at least a week before the big event. So they're not going to have that redness on the skin, you know, that like swelling as well. So you are going to be red, but your skin's response is different from person to person into how soon it goes back to normal.
Oh, okay.
Okay, any other questions?
So it would actually work in one session, or does a client need to come back for the next or 3 or 4 sessions or something? You know, it's similar to your chemical peel. You know, they actually need to come back for a couple of more sessions to actually see the results. Is this going to be 1 or more sessions?
You will definitely see results after 1 session, but we would recommend that your client comes for a course of treatments of a minimum of 5 to 6 sessions. So that will just, you know, strengthen the skin and the results will be a lot better. So if you look at pigmentation, for example, so 1 session is not going to break up the pigmentation immediately or bring all the pigmentation to the surface. It is going to take a number of treatments depending on how deep that pigmentation is, if it is epidermal or if it's dermal pigmentation. So it's very difficult to say you're going to have no pigmentation after 1 or 2 sessions. So we always suggest to our clients to do between 5 and 6 treatments. Take a little bit of a break, like a 2-month break, and then you can always reset the situation, see where they are with their treatment, and then perhaps you can suggest another course of sessions. But it all depends on the condition of the skin, how bad the condition is, and then if they are good with their home care, afterwards as well.
Okay, yeah, because that also definitely needs to come along. I have, you know, because I always send you WhatsApps and everything of that sort. I have really stubborn clients with commercial products, and they always insist that they want to do the clearance, they want to do this, they want to do that. And of course, I'd emphasize that to the clients that once you start with Sknlogic, continue with the Sknlogic products. But cancer clients, they would fit a toner here and fit in their own mask or their own day cream and everything of that sort, depending on how they feel their skin is treated. And then, of course, stuff like that, the skin will actually get irritated in between. When we now move on now to the phases of actually using the micro needling, how strict is it that the clients should definitely be on a Sknlogic?
Look, the thing is, obviously you are going to use our serums, during your micro needling sessions, and we don't know if they're going to use 1 or 2 Sknlogic products, and then they're going to use 1 or 2 of the other brands' products. We don't know what their chemical makeup is out of that product, and we also don't know how it's going to react with our Sknlogic products, because obviously we don't do any testing, to use multiple brands. So that is why we are quite strict. So we do prefer that the clients only use our products afterwards, because otherwise we don't have, they can't come back to
guarantees. Yeah.
Treatment isn't working. I'm actually getting a rash, or reaction or complication. But if they're not using the product that we prescribed, we can't go back and see, okay, why is this happening? You are using this type of product. Have you used too much of the product? That type of thing, because we don't know what the other makeup is of the other brand. So then, we can't help them any further. So they need to make a choice. If they want to do your Sknlogic treatment, then they have to be on the Sknlogic range. And you as a therapist also need to be strict with your client, because otherwise you don't know what's going to happen on their skin, and you can't take any responsibility for their client's skin. You also don't know how long the treatment results are going to last, how long it's going to take to get results, because you also don't know what the other products are made of.
Okay. Good to go.
Okay. So like I mentioned, so these microchannels are going to allow penetration of active ingredients much deeper into the dermis and to the fibroblast cells. And this is then basically going to feed the cells found in the dermal and in the basal layers. So this increases the absorption of active ingredients into the skin and stimulating repair at a cellular level and accelerating the regeneration of the skin's epidermal cells. So that is going to increase your cell turnover and fasten, your exfoliation process.
Okay.
Okay. So then,
one more thing. Sorry, 1 client, 1 needle. Even if you use the 1 needle in different ways on the client's skin, but of course, it's a rather silly question, but yeah.
No, that's perfectly fine. So you've got a needle with 12, so it's a cartridge with 12 little needles. So like I mentioned, you can control the depth as well. So each concern will basically have a needle depth. So it's either 0.25 up to a 1 millimeter. So us as therapists, we can't go higher than that. We are only legally allowed to do up until 1 millimeter on the skin. But then you just have to judge the client's skin, how thin the client's skin is, if they really need it, that type of thing. If you're going to do pigmentation, because it is, very superficial, you're either going to do 0.25 or maximum of 0.5 millimeter. So you need to know in which areas of the skin certain concerns, would be treated. So that's very important that you know that. So after the first session, you will start, seeing results, depending on the severity of the client's skin condition. But with up to 10 sessions and then follow-up treatments, your result can last up to 2 years. So with your regular, maybe every 4 months or twice a year maintenance sessions of the treatment. So, but like I mentioned before, you'll do your course of treatments, give it a break for about 2 months just for that skin to settle. And then your client can come in for another skin consultation, and then you can reassess the situation. So why the Sknlogic SKNpen? So the battery, it is a rechargeable battery, the lithium battery, and then it's got 1,000 milliamps. It's got an independent charger, and you can work for 4 hours with that. So if you've got load shedding, you can still go ahead and do one of your SKNpen treatments. So you'll still be able to generate money while there is like a power surge or something like that. So that's quite a nice, treatment.
It definitely is.
Then we've got 6 levels of adjusted speed control. So it's between 3,000 and 12,000 RPMs as well. And if the RPM is too fast, it can cause over kneading and cause damage to the skin. So you just need to, later in the manual, there is for each skin condition, on what speed you need to work. So if you do it too fast, then it creates too many channels in the skin, and then that can cause overstimulation.
Okay.
So the pen also has an aluminium alloy body, so it's a high-grade material, it's durable, and it's reliable, and it's got a very good heat dissipation, so your pen won't get very hot.
Okay.
It's comfortable for you to also work on the client. Then it's got a integrated reciprocating German motor, like I mentioned before, so it's very durable and stable. It's got low heat, and it also has a very low noise. So when you put your pen on and you hear quite a loud noise, then it will mean that your needle wasn't inserted properly.
Okay.
So then adjustable needle depth. So we've spoken about that. So it's a very accurate adjustable needle depth. So it's from 0.0 millimeter to like a 2.5 millimeter. But like I've mentioned before, so us as therapists, we're not going to work higher than 1 millimeter. Then it's a 2-in-1 operation, so it's rechargeable as well as with a power adaptable, and it's got quite a long power cord that you can use to charge while you're working, so it's very comfortable. And then it's got a matte finished body, so that means it doesn't slip.
Yeah, I've seen that.
It's not a smooth pen, so it's got that little bit of a like a mattifying body on it. Okay, so SKNpen has got superior anti-backflow needle cartridges. So the needle thickness, it's a 33 gauge or 0.2 millimeter thickness, which creates your tiny microchannels with less pain and less trauma to the skin. So the material that is used is surgical grade stainless steel, and it's very strong and very reliable, and it's also very hygienic. So it comes in a separate little pouch for each client, and each client gets a new cartridge when they come for their treatments. So the 12 needle pins, it's perfectly spaced in the algorithm calculated needle placement and position. So it's perfectly spaced out for even distribution on the skin. And then EO sterilization, it just means that it's got advanced sterilization methods for complete needle tip sterilization. and it is designed to be disposable and a single use only. So you're only going to use it once, and after your treatment, you're going to discard it. So anti-backflow silicone membrane. So this is going to prevent fluid from flowing back into the device body. So it's not going to go into the pen itself. So then it's got vented holes. So this is so that it can actually release air, that's air pressure during the high-speed needling for skin safety and protection. So if there's no vented holes, then the air pressure would cause movement, and it would actually stuck the skin, and that can cause tissue damage. It also has a fluid filter. So this prevents contamination of the needle. And then it's got a lock-in installation. So it's easy to install, and it locks the needle onto the pen. So you know that it's going to keep the needle stable, and it's also going to reduce the risk of any contamination. Okay, any questions on that?
No, I'll go through this when I check the case again. Yeah.
Okay, 100%. Okay, so now we get to the different needles, the needle cartridge varieties. So you can actually do permanent makeup with the pen as well. So then you will just add different needle types onto that. Okay, so as I mentioned, you'll be able to do permanent makeup with this device as well. So it's just a different needle cartridge that you'll be using.
Okay.
So this 3R, it's like a 0.3 millimeter. So this is commonly used for your permanent makeup. So that's your eyeliner, your eyebrows, micro needling, lip liner, white light, camouflage, and shading. So all of that. Then your 3F is a little bit of it's more like a straight line. So that's also for shading, like in the hairline perhaps, or eyeliner, or lips and brows. So then your 5R is also more for like the soft color application in your permanent makeup. And your 5F is also for more shading the area, such as the hairline or the eyeliner. So those, and then you've got your 7F, which is you can use for your permanent makeup as well as skin needling treatments, such as acne, scarring, fine lines, and wrinkles. Your 12 pin is like evenly distributed for most skin needling treatments, and it's the most popular cartridge. And then your 36 pin, this is for your treating melasma, your pore size, your micropigmentation, and then your fine lines. And then your nano, so that is for, it's more to help with product penetration. So that is almost like a microdermabrasion type of treatment. So you're basically just going to you know, remove that dead skin layer from the skin, like a very good exfoliation, just so that your product penetrates a lot better into the skin. So we use the Omega Face Oil for our gliding serum. But we've also lately been testing, you can use the other serums you can use as well. So I've actually done a treatment this morning, and it really gives you very nice gliding. So then you actually glide or needle the booster into the skin. So this is your C10, your C15, your B10. And when your client is being like after 3 months of being on the range, you can needle the retinol 0.5%. You can needle that into the skin as well.
Okay.
Okay. So I'm just quickly going to run over the Omega Face Oil. So you obviously know it because you've done your change. So it's a very lightweight facial oil that can be used as a moisturizer, a treatment product, or a primer. It contains your omega-3, 5, 6, 7, and 9. And then for your clients that are very sensitive, it can be used as a moisturizer. So you've got all your active ingredients, so you can see that it's very healing with your vitamin C. It's got lots of antioxidants in with your vitamin E. And then your macadamia oil is anti-inflammatory, so that's going to help just to soothe the skin. And then your argan oil is going to help with cell growth. So it's really it's a packed little oil with lots of you know, what it can offer the skin as a gliding serum and then afterwards. So yeah, so you're gonna do it section by section. So because it penetrates so quickly into the skin, you're not gonna apply it over the whole face, because when you get to a certain area, it's going to be absorbed.
Okay.
Okay. So the next one is your hydrating peel-off mask. So what you can do that as an extra for your treatments, after you have done your kneading session, you can put the hydrating mask, the peel-off mask, onto the skin to soothe the skin and just to cool the skin down after the session. Yeah, so then you're just going to leave it on for about 20 minutes or until it's dry, and then you can just remove it. So this is really going to just help to soothe the skin. It's going to help to calm the skin, especially for those clients that are quite red. This is a beautiful product that you can then use on their skins. So then you can maybe do like your B10 underneath this, just to help with that soothing process, with the healing process, with barrier function, those type of things. Okay.
Okay.
Okay. So then we get to possible reactions that might occur on the skin. So you can have like a bit of a tingling sensation soon after you have your treatment done, or you're doing your first start your kneading process. So that is typically normal. It also with your retinol, for example, because retinol normally does tingle, as well as your C15, you can have that tingling sensation. And it's also just because you are stimulating the skin so that you can have that reaction. So the skin will become red and inflamed. So it's similar like a moderate sunburn. So your clients will also feel that tight and like warm sensation on the skin. So the skin will feel tight, like I just mentioned. And the clients may experience a little bit of sensitivity, redness, and even acne breakouts and darkening of their pigmentation a few days after the treatment. So these are all normal reactions to the treatment. So you don't always know what acne lies deep underneath the skin. So when you stimulate that, that can come to the surface and have that breakout. Same with your pigmentation. So you're stimulating your pigmentation that's lying underneath the skin, and with your new cell turnover that's sped up, that pigmentation will come to the surface. Okay. So this is called the healing crisis, and it can be expected because of the structural and functional changes within the deeper layers of the skin. So it is very important to tell your client before they do their treatment, that this might happen, so that they know what they are in. Clients can also experience a little bit of a mild sensitivity. And then for most patients within 48 hours, the skin may show redness, dryness, and inflammation. And this can last up to 7 days, depending on the depth of the treatment, as well as the condition of the skin. Okay, so if you've done like a 0.75 and a 1 millimeter on the skin, then you can expect to be redder for a lot longer. And then also, depending on the client's condition, their barrier function on their skin. So then your client can also get allergic reactions. So due to the active ingredients used in the treatment, and because it penetrates a lot deeper, so skin allergic reaction can occur. So it is normal, but its ingredient allergies will cause a mild histamine response, like a little bit of an itching or a little bit of a rash. And this can easily be addressed with either an oral antihistamine or a topical anti-inflammatory, like your cortisone or those type of creams. So of course, it's best to avoid reactions. So therefore, it's important to do a patch test of the serums that you are going to use on the client's skin, to make sure that she doesn't have a reaction. If you are not sure, then rather just use the omega oil on the skin, because it doesn't have any very active ingredients. So your client won't then have a reaction to that.
Okay.
Okay, perfect. So then important precautions to use. So all clients must fill out a consultation card when they come in to do the treatment, and they have to sign the indemnity form that you and that you they must also sign that you have explained to them what you
Yes.
have what they can experience. And your client needs to sign an indemnity every single time that they come for a treatment. So they might have changed their medication, they might have changed their diet, they might have been diagnosed with a condition that you're not sure of. So, and that will have an outcome on the thing. So you need to do a proper consultation each and every time before you do your treatment, asking your client, are you on any new medication? Have you been under the care of a doctor? Is there a new condition that I'm not sure of? And then you need to make a call if the procedure can happen or not. But it is important that if something do happen to them and they come back to you and say, but this is what happened now, but I've got cancer now, then you don't ask them, is there any new conditions that I know of? Then you can be in trouble. By them telling you that there is new conditions and they signed off on that, they've got no foot to stand on, you know. Okay. So, so your therapist is not allowed to do the treatment if they haven't passed the Sknlogic training. So they need to have their Sknlogic training. All therapists must wear gloves during these treatments, mask as well. Then the client needs to be on the Sknlogic home care for at least 12 weeks before you can introduce this treatment. If the client has been on a cosmeceutical skincare range prior to this, then the client can start doing the microneedling for like 4 weeks to 8 weeks. Smoking, your client should not smoke before or after the treatment, as this reduces the oxygen that reaches the tissue, and smoking will also thicken the blood, obstructs collagen formation. Okay, so you want to avoid the sun, tanning beds, excessive exercise, and scrubbing or picking on the skin that can lead to scarring. And then you're not going to wax 48 hours before the treatment and then 7 days after the treatment. And you're not going to exfoliate the week after you've done the treatment as well.
Okay.
Okay. Then, like I just mentioned, you're not going to use any exfoliating treatments, products with glycolic acid or salicylic acid or your benzoyl peroxide for at least 5 to 7 days after the treatment. And you would like them to stop 7 days beforehand. So a week before and a week after, because it is an intense treatment. Then you're not going to use any vitamin A products a week before and a week after. And then your clients that are a Fitzpatrick scale 5 and 6, you are going to just be very careful when you do that, because that can cause very dark pigmentation on the skin. So you're going to treat the skin for more than 2 weeks just for optimal. So make sure that the skins, you're going to use your omega, your products that's going to strengthen the skin.
Okay.
Okay. And then your Fitzpatrick 5 and 6, they must use lightening agents at least 2 weeks and then continue after the treatment. So that's going to be your diminished day and your diminished night.
Okay.
Okay. That's just going to help to prevent the pigmentation.
Okay.
Okay, so contraindications. So clients that have already got very thin skin or that are very, very sensitive. Any active acne, because you don't want to spread the infection. So if your
what do you mean by active acne?
So acne that's got pus. So your pus.
Okay.
So injectable neuromodulators. So that is your Botox type treatment. So they for up to 2 weeks after they've done Botox, you can't do your microneedling. Okay. Then if you've got diabetics, they have to get a consent form from their doctor. If they've been on Accutane, Accutane or cortisone, they have to be off it for 6 months or more. Any recent laser treatments or chemical peels or things like that. So I would advise 4 weeks between treatments. Okay. So any autoimmune diseases such as radiation or things like that, because this is going to cause inflammation on the skin, that inflammatory response can trigger the autoimmune disease. Any scleroderma, collagen vascular disease, or any cardiac abnormalities, can't do that. A history of eczema, psoriasis, or actinic keratosis on the skin. Any keloid scarring, because this is going to create a controlled injury. You are going to work on the tissue so it can scar. Pregnancy or breastfeeding, skin that is sunburned, any recently waxed skin, exfoliated, or if they've been in the sauna 48 hours before, any open wounds, or if your clients are struggling with the poor wound healing, and then only any open sores on the skin. If your client has got blood clotting problems, or if they are bleeding, any raised moles on targeted areas, you're going to avoid that. Okay, so if your clients have got any active infections like cold sores, if they've got any infectious disease, because obviously you don't want to contaminate yourself or spread the infection to other areas. If your client is not someone that is going to use sunscreen, then you're not going to do this treatment on them. Any excessive dry skin, because this treatment will dry out the skin a lot more. If they've had any facial radiation, so on their skin or on the neck area, you're not going to do the treatment. Herpes simplex. So if there's any hives or any active ingredients, your client needs to make sure that they are on a treatment program before they come for this treatment. So if they have hypertrophic scar formation, so that is like your keloid scarring, if they've got visible redness or irritation on the skin, if your client has a history of very reactive skin, then you're also not going to perform any recent cosmetic injections within the last 5 days, and then obviously any cosmetic surgery. So you will wait like 6 months after the treatment, but they need to have a consent from the doctor prior to treatment as well. Okay. So aftercare, your client may only use Sknlogic products after the treatment, and it may not include other products into their skincare routine from other product ranges. You're not going to use your Night Plus, your hydrating serum, or your multi-active lotion for 5 to 7 days, or until visible inflammation or sensitivity has cleared. You're going to avoid direct sunlight for 24 to 48 hours, and you are going to use your sunscreen. You're going to avoid any excess exercise or exposing the skin to any heat, such as your saunas, your steam rooms, your jacuzzi, or your normal chlorine swimming pools. You're not going to wax 7 days before or after, and don't take any anti-inflammatories after the treatment. So your skin needs to go through that natural process. Okay, so the needle length and the speed selection. So always make sure that the needle depth is set on 0 before you insert it into the machine. Otherwise, it's going to not fit properly, and it might also push out the needles. Make sure that the needle depth is always on 0 before starting a new treatment, and always turn the pen on before selecting the needle depth. So you're going to turn it clockwise after you've switched the pen on, so not beforehand. Okay, so 0.25 is for enhanced penetration, and it's also for epidermal pigmentation. So then you are going to use a speed of 1 or 2. Then your 0.5, that is for fine lines and wrinkles and scars, UV damage and hyperpigmentation, and then for very mild collagen stimulation. So that's a speed number 1 and 2, and that is 4 weeks between treatments. Then when you go up to a 0.75 and a 1 millimeter, this is for your shallow to deep wrinkles, for scars, for stretch marks, mild collagen induction. And then that is on a speed of number 2 to 3, and that is 4 to 6 weeks between treatments. And then the rest we can't do because we only do up
1
to
millimeter.
1.
Yes.
Okay. Okay. On a 1 millimeter, that is for your deep wrinkles, your severe scarring, and for full collagen stimulation, you can do a 3 to 4, and that will be 6 to 8 weeks between treatments. But that is up to where we are going.
Yes.
Okay. There we go. So then you've got your application technique. So you're going to go through your consultation card with your client, what your client's expectations is. You're going to do before photos, because obviously you want to see the results of the client's skin. You're going to the record card and the indemnity form must be signed. And then, so you're going to do your patch test to make sure that your SKNpen is fully charged. You have to wear gloves and a face mask, and then you're going to start your treatment. So your trolley needs to be set up with your products on a paper towel to make sure that it's clean. You've got your closed sachet of your pouch with the needle in it. Yes. And the needle you're only going to open in front of your client when you start the treatment. Okay, so you're going to remove eye makeup and makeup on the face with your remove. Obviously not on the eyes because it's got olive oil in. So if your client's got lash extensions on. Then you're going to cleanse the skin with the cleanse wash. You're going to exfoliate using your exfoliate enzymatics for 2 to 3 minutes. Then you're going to tone the skin. You're going to apply your numbing cream like your EMLA, and you're going to leave it for 15 to 30 minutes. So the longer you leave it on, the more numb the skin is and the more comfortable it is for your client.
Okay.
So while the anesthetic is on, you're going to explain the procedure to your clients, and then you're going to also advise them on aftercare.
Okay.
So then you're going to, when you're going to start your treatment, you're only going to open it section for section. So you're going to work on the one side of the forehead. You're going to remove the anesthetic with a sponge, and then you are going to remove it with your Quadex, the Bigramine. So with a little bit of piece of gauze, just to remove all traces of anesthetic cream and to sanitize the skin the immediate skin. You're going to do your treatment. You're going to use your gliding oil or your serum, and then you're going to glide over the skin. And then you are going to follow the specific pathway that I've sent to you as well. So if there's any visible bleeding, then you can just massage that blood back into the skin, because that contains your growth factor hormones. So, and then it's also important to always lift the pen when you change direction. So if you don't do that, you can actually scratch the skin. Okay, perfect. So then the first pathway is basically from the bottom, and then you work your way up. So you're going to work in upward motion. So that is the blue line. Then the red line is you're going to work diagonally, like over the skin. And then the solid line, you're going to work upwards and outwards. So you're going to work across the face.
Okay.
Okay. Okay, so then if you want, you can do your face mask after you've completed the whole face. You can do the peel off mask for 15 to 20 minutes. Then you're going to tone the skin. Then you're going to apply your moisture cream or your moist, depending on the skin type. And then you're going to use your sunscreen. Okay. If you are wanting to put like foundation on, then it should be like a product that is not mineral based, so it's a natural product. But preferably your client shouldn't wear any makeup until the micropores are like closed. Okay, so that is the pathways. So the blue ones is from the bottom up, the red ones are from the inside out, and the yellow is like slightly across the face. Okay. And then always wear a face mask and gloves during the treatment or when operating the pen. If blood appears, massage the blood into the skin. And then at the end, you can just use, if there is any excess blood, you can just wipe it off with clean. But this is just to maximize the benefit of the growth factor hormone. And then you're going to dispose of the cartridge in a sharp box. You're never going to reuse a cartridge. And you're going to never reuse sponges or other consumables for next client. So everything that you have to use on a client, you're going to discard of. Okay, so this is just the maintenance and stuff that you can read through. So always dispose of the needle afterwards. Don't keep or store disposable tips for later use. Use clean gauze or paper towel. You're going to wipe down the entire surface with a disinfectant like bacterial before and after the treatment. While wearing gloves, you're going to clean the SKNpen and the cord, and then you're going to use a cotton bud just to make sure that you get all of the product out of the pen. And then you're not going to leave it plugged in for long periods of time, especially with the load shedding. It takes 2 hours to fully charge. So once that 2 hours is finished, then you can just take it off and store it. Okay. So like it mentions here, so it takes 2 hours or until the green light turns on. And then it's got a 12-month guarantee from the date of purchase. It does cover the motor, but it doesn't, if you are going to be negligent with your pen and let it fall, then your warranty is not going to cover any damages. So we'll only cover if the Sknlogic pen cartridges are used. So if you're going to use a doctor pen or any other thing and it breaks, we're not going to cover you. Okay.
Right, so we're going to start off with cleansing. I'm just putting another blanket on my client here. Yeah, so we're going to start off with cleansing. So usually prefer to do at least a double cleanse, especially if the client is wearing makeup. Oh, yes, the smell. Yeah. So the smell that you get from the products is purely from the main fruit extract in the product. We don't have any perfume in our products. Especially the cleanse gel with the grapefruit really smells amazing. So after the cleanse, we're going to do the exfoliation with the enzyme exfoliator.
Okay.
So with the enzymatic exfoliator, we will do circular motions for about 3 to 5 minutes. And the microneedling, we will not use steam on the exfoliator.
Why is that stimulating? Hey?
Yes. So in your advanced facials with your advanced clients, you can use steam on the enzymatic exfoliator to enhance the exfoliating action. I'm just going to get clean water to remove the exfoliator. After the exfoliation, we're going to tone. And after tone, we just blot the skin and make sure it is 100% dry. Okay, and then you can get your numbing cream ready. Did you manage to find the EMLA?
Oh, yes, I found one. I got carbon box. It works out better than buying from the pharmacy. I bought them from Thursday.
Okay. So we use 5 grams, which should cover the face and the neck. So I prefer to apply it with a brush, but you can, apply it with your hand as well. So we're going to start at the forehead. And then we're going to work the way down with the numbing cream on the face. It's also important to remember to go close to the hairline, because if we don't go close enough to the hairline and we do the needling, sometimes they feel a prick at the hairline. And then also it's quite sensitive on the top lip area. So just to make sure to go close enough to the mouth as well. Okay.
Are you using a small tube on a 5 gram tube?
Is that a 5 ml tube? A 5 gram.
How much are you using?
So a 5 gram tube, you will probably use the whole tube on the face neck.
Okay, that's what I wanted to choose. Okay.
Okay.
I'm going to apply. You apply close to the eye area.
So you will apply close to the eye underneath, because we're going to work quite close to the eye, on the under eye area, and also you can also just underneath the brow. Okay, so once you applied your numbing cream to the face and neck, we're going to do the cling wrap part. Okay, so the cling wrap, so I normally cut in sections. I cut a section big enough to put on the forehead. So I'll do that one first. And with that, you'll also find your own mojo, what works for you. And then I do another broad one over the chin and neck area. Like a little puzzle.
You know, I've got the nicest little thing that just snaps it in place. I don't know if you can see it.
Sorry?
And it's a lovely little thing that you just use. So you just take it to where you want to.
Wow, that's awesome.
Yeah. Yeah.
Oh, yes. And then you just slide it. Oh, wow.
Yeah.
Yeah, we should.
I thought this is something. I'm very fancy.
Oh, very fancy. Then for the cheek areas, I normally cut like a square and put it from under the eye over the cheek. Then I cut a little triangle for the nose and a little piece for the upper lip. And then a nice big piece for the neck area. Right, so your client's face is wrapped. Okay, so I think it's now it's past 10 to, so we can start with the treatment at 1/2 past. We have a skin pen holder that the pen can sit on. You can also use a kidney bowl where you can put your pen in with onto a piece of gauze with bigger mine. It's just to in between help prevent it from getting contaminated. So I always open my needle in front of the client so that they see it's a brand new needle. And then as you can see, I mean, you have played around a bit on your hand, you said. And then we're going to start with the forehead, and we're going to remove the cling wrap from the forehead. And then we're going to use a dampened sponge, clean dampened sponge, to remove the numbing cream. And then we're going to clean the skin with the bigger mine. And then we're going to apply our omega oil, our gliding oil on the forehead. And then you're going to set your needle . Okay, then for the forehead, you're going to put it on 0.25 and you will do speed 1. Then we're going to first start off with horizontal. We're going to start off with, so you can decide if you first want to do half the forehead or you want to do full the whole way across, just what works for you easier. I normally like to do it half. And it's important to hold the pen perpendicular to the skin, that we don't go back and forth. We lift it up before we do the next stroke. And there you're going already. There.
Moesten wat was het ook ooit aangehouden?
Ja, dat is dan niet.
Oei hoor.
Zie?
Ja, kom op. Oei.
You just need to be careful if your client had any permanent makeup done, brows, microblading done. It can lift the pigment, so we just need to be careful on the brows. So after your vertical, we're going to do the horizontal strokes. Sometimes your client might want to sneeze, so you can just ask your client if she feels the urge to sneeze to just put up her hand there, that you know, just to stop for that moment.
Dat is ook weer weg.
If there's a little bit of blood, you can just rub it into the skin. And then after the vertical, we're going to do diagonal.
Daar sit weer weg. So overwhelming. Probeer om inhou.
Dat het nou niet uitkomt. And then we're going to do circulars, just to make sure that the client doesn't have any zebra stripes. So then we can just going to go over the whole area in circular motion. Like a medium speed, we don't go too fast and we don't go too slow either. But we want to make sure that we've reached every area. In between the brows, if your client has a deep line, we can do what we call stamping. My client doesn't have a line, but just to show you, we basically go, if there is a line, we'll go 1, 2, 3, 4, 5, 1, 2, 3, 4, 5 on the lines. And even if there's maybe like a few deep lines on the forehead, we can also just on the line itself go, as we say, call it, do the stamping.
Okay. They are.
Oh, that's different. Okay, so then from the forehead, I'm going to move on to the nose. So the nose can also be quite ticklish for the client, or might make them sneeze. So with the nose, we don't do all the horizontal and vertical, etc. So mostly, I just basically do a bit of horizontal, vertical, and then more circular motions on the nose. So as with every area, we're also going to clean. And then gliding oil.
Oh, right.
We don't really get, except for the bunny lines at the top of the nose, we don't really get wrinkles on the nose itself, but it helps with the reduction in pores.
Yeah.
So then we're going to do under eye and cheek area. Okay, so for directly under the eye, we will always do it on 0.25 because the skin is very thin there. And we do it in an outer motion, otherwise the client can get a little bit puffy, always from the inside out.
Look, will you keep off?
Point two five.
Yes, 0.25. And you can go quite close to the eye area. And we basically rest the pen on the skin. We don't push into the skin because the pen does its job. Just about
If you actually got
3 to 5 times.
how many?
And then for on the side of the eye where the crow's feet area, we can then go turn that up. You can turn it up for your client then to 0.5 for the first treatment. And if you're on 0.5, you can do it on speed 2. So again, we just do the horizontal, vertical, diagonal, and circular. And then you can also decide if you want to do smaller blocks. Well, we first can do it around the eye, and then when we do the cheek area, you can decide if you want to do long strokes or work in smaller blocks.
Mm-mm.
And then what you can also then do is again the stamping. If there is a line, you can also do the stamping.
Good.
Mooi bang, Leona. Liefst.
Thank you.
And then I'm going to do the other cheek.
Hier is iets aan boord.
Dis weer in die oog. Ek het myne al in my oog wat ek hom so oorpin nou my oog.
Beter? Dankie.
So then again, under the eye, 0.25.
My oor lyk vuil. Vir my roots binne my oor gespuit.
Jy
Af te vee. Ja.
het dalk 'n goeie ding, nou kan ons my oortjies skoon om.
Ja, so moeilik is veiligheid.
Sy voel dit reg, dit daar nie binne.
Ja,
my eie
dankie.
woord nie. And after you've done the under eye area, you'll just continue with your 0.5 on the rest of the. Are you doing better, Ian? Good. And then the lip is also on the size above the lip. You can do, horizontal, vertical, but just depends on what's the best motion. That area can also be a bit sensitive to the client.
All right. Heeltemal fyn.
Nader genoeg gekry. And again, if your client's got like deep marionette lines, you can do stamping as well.
Ach nee, dis fyn. Doen afstaan. Whatever you do.
Ek is 'n mami hier toe.
Die arms wat in
Die arms wat met die voorwind, ja.
So, okay.
So, ek wat ek kan onthou, jy moes een keer een kaart of iemand het verjaar. Nee. Dit is die laaste keer dat ek jou gedoen het, want jy is met 'n rooi gesig hier weg na iets toe.
Dis seker so.
Ja, en ook gevra ek met mekaar moet doen, maar dit is soos Saterdag kan wees om nou nie 'n masker te moet dra nie. En dan moes voor dit nou nog nie te sê. Ek genees ek moes sy moet nou een Chris gaan dan as lank vir self doen. Ja, sakte tyd so. Ek ook nou kan gaan. Is dit ook nou kan kyk nie? Wat is nou?
Max Falcon.
Like our own worst critics. It's not 0.5. How's your client doing? Not feeling anything?
No.
Okay, so the EMLA worked well. Good. Any erythema? Are you seeing redness?
Yes, a lot.
Okay.
Wow.
Wat een hospital. Yes, I normally also like to turn the head when I do the neck to get nicely also to the back of the neck area as well. Okay.
Oh. Oh. Hmm? Come on.
Wat heb jij een keer gemaakt? Para, wat zit er een keer geleerd?
Sim. Vai ser que broodterrassen. Dat is de tweede taal.
Is gewoon een masker.
Ik zeg een kruidje.
Ik ga het niet met de masker zitten. snel veranderen. was eintlik gevra het om 'n videoetjie te gemaak het van.
Ja.
Ja. Okay. Also good that side.
Yes.
Kan dit lekker?
Ja, te bom. Ja. Is okay. Uithoubaar. Naling ronde gaan seker aan.
Okay, so then we're going to mix the mask. And then we're going to apply the mask.
So koud, ekskuus dit was
slide mine over the eyes as well.
Yes, you can. Yes.
Yes, it's nice and squeezy. It's nice.
Perfect.
That's
And
fine.
sorry, I think I mixed mine a little bit too runny.
Hey, but then you don't want to add more powder, then it's fine. As long as
Yeah.
it's not in the hair, it's fine.
So that happens sometimes. And then we're going to tone and apply moisturizer and sunscreen. If you want to, you can again put a few drops of the oil on after toning. Lekker gewerkt. Lekker gewerkt vandaag.
Fantastisch.
Volgens mij moet ik hem nog aan.
Ach, dat is een beetje vanochtend, ja.
Dat is maar weer zo beskoffend en toekennen.
Niks ding.
Want die vraag is mij, ik denk dat is een wat er aardig goed gegaan van ook wat oorlede is. Maar ook terug en tevens uit kanker. Dus oorlede. En dat is man. Grondgoed in een kort tijd. Denk niet lekker aan.